Hi, my name is Stacey Pitts. I'm the co-founder of CBD BioCare, and joining me today is Dr. Frank Michalski. He is a chiropractor, functional medicine expert, CBD expert, and CBD BioCare expert. And so today we are going to talk about the importance of getting your blood work done, understanding what the blood work is going to tell you and your physician, and really creating that baseline and seeing how CBD can help improve some of your numbers potentially. And we're going to use Dr. Frank's own blood work to serve as an example. So hello, Dr. Frank, thanks for being here.
Of course, glad to be here, Stacey. Good to see you.
So let's dive in and talk about the importance of blood work. It's always something that a physician says, or it's recommended to have an annual blood work done, a screening done. So let's talk about what's important and if some of the tests that you're going to mention are the tests that are usually ordered. I think there's about 5 that a physician normally says, let's get these tests done. But maybe there's more that you would recommend that would indicate inflammation or some other issues that can be precursors to disease. And let's talk about how CBD can potentially help.
Of course, we can go through all that. So I'll start with some of the basics, and I guess the most basic point to say would be blood work is important. Blood work from a physician point of view is a snapshot into the human body, and it's not only a snapshot into one part of the body, but it allows a physician to analyze multiple parts of the body in one snapshot. So we have people who say they don't like getting blood work done, the needles make them uncomfortable. We always encourage patients to follow up with whether it's through their primary care, a naturopathic physician, a specialist, to obtain those blood work values, to obtain those in a timely manner too, because it allows physicians to catch disease before it becomes a real problem. So getting your regular blood work, going for those annual blood tests is a very, very important thing. With that being said, depending on the physician that you're seeing, the type of blood work being ordered may vary greatly. If someone has a background in functional medicine, they have a reputation for kind of being like vampires. They're usually ordering a lot more blood work than just your standard primary care physician visit, a follow-up would do. If you're seeing a naturopathic doctor, they're usually requiring a bit more detailed of a workup too. But let's discuss a little bit about some of the basics that we see at a doctor's visit, just your standard visit to your doctor, a healthy individual. And I'm actually going to be referencing off of my own because we'll talk about some examples throughout the years that I experienced and some health issues and how I feel I've seen a difference with CBD and other lifestyle changes. So we'll dive right into that. So the first panel that you usually see ordered is called a comprehensive metabolic panel. So this is a panel that's a snapshot of liver function, kidney function, your electrolyte levels in your body. How well hydrated are you? How are you handling proper nourishment? Are you malnourished? We can start to see some signs of that in these panels. I would say the most common thing that usually creates a red flag in a comprehensive metabolic panel, and a lot of people will be familiar with this, is their blood glucose levels or their blood sugar levels. Anyone with diabetes or pre-diabetes has to keep a close eye on this. The other thing that we touched on in the inflammation seminar was chronic kidney disease. A lot of elderly patients, a lot of people who are not properly nourished, they tend to suffer from this low-level chronic kidney disease, which you can see in the eGFR ratings or the GFR ratings. You can also see it in your bone creatine ratio ratings. So the comprehensive metabolic panel is a standard test, and it's a quick snapshot of the liver, the kidneys, and your electrolyte levels. Now, the other panel that I would say most of our listeners are familiar with is the lipid panel. So this is where we look at cholesterol as a whole. So when we talk about cholesterol, you have your total cholesterol, then you have what's usually referred to as your healthy cholesterol, your HDL, and then there's your LDL, which is usually looked at as the bad cholesterol, and your triglyceride levels. The combination of these values, your HDL, LDL, and triglycerides, are what make up this lipid panel that's commonly ordered at a physician office. A lot of people, I don't think, fully understand cholesterol. A lot of guidelines that are still being followed today are old school guidelines when it comes to assessing someone's risk of cardiac health. you look at more of the literature today, and I think it's rarely discussed sometimes, it really points out those triglyceride levels and the HDL protein levels. If people have triglycerides above 100, we're really starting to be concerned about that low-level inflammation. Triglycerides are little pockets of fat that are stored in your bloodstream when you have excess glucose present in the blood. So if you think of glucose as sugar for energy, that's excess energy, and we store that as fat. So triglycerides are a big risk factor for heart problems, and so is having a low HDL. If you take those two values together, I think you would be able to find a lot of physicians who would say high triglyceride levels and decreased HDL is almost more alarming than an overall elevated total cholesterol. A lot of people don't realize it, and it's not a test commonly ordered, but when you talk about bad cholesterol, there's different levels of LDL. There's very low density lipoprotein. There's low density lipoprotein. And all LDL isn't necessarily bad. So with a lot of patients, if their HDL looks good, their triglycerides look good, but their LDL is off the charts, sometimes we may order some more advanced blood work on them to see if those are healthy LDL particles or if they're dangerous LDL particles. So that's one of the tests that's not always ordered, that additional testing for the LDL. The other big one that you see in a doctor's visit would be a blood cell count, a complete blood cell count. This is where it looks at your white blood cells, your red blood cells, lymphocytes, neutrophils. This is a nice snapshot of the immune system. You can pick up other disease processes on here, but usually when we see just day-to-day fluctuations in these numbers, it's indicative of a bacterial infection or a viral infection. Now, this is also how certain cancers are picked up. If we see dramatic changes in the blood cell counts, then we start to really have some concern. This is also a great screen for anemias. So people who are presenting with chronic fatigue syndrome or fatigue, in our offices, we're always saying, okay, that's great, but what's the underlying cause of the fatigue? Is it an anemia? Is it this low-level chronic inflammatory disease? Why do they have it? A blood count is a great panel to pick that up. The other thing that I would say is pretty standard in most doctors' offices nowadays is checking your HbA1c. So this is your average blood sugar levels over the last 3 months. So you take your glucose levels and you can get an average of those, a snapshot of how you've been doing over the last 3 months. And today that's a pretty standard test due to diabetes being on the rise, due to prediabetes on the rise. This is also a great screening test as well. Those are probably the major tests that are ordered at your general follow-up wellness type visit with your primary care physician. They may order a TSH and a T4 if you have thyroid problems, or if female of a certain age, they may choose to order that. It really depends on who you're seeing, though, whether or not they'll do that. Now, before I jump into some more advanced testing and things that we recommend, do you have any questions for me on the basics of the blood work and what it is we're looking at?
Well, as a patient, I would be thinking, okay, how do I know when is it at risk? So those are, I know there's usually a range, a safe range. Is that dependent? Is that for a doctor to determine on what the safe range is?
So it is. So it's fascinating. So I always encourage patients, always, nowadays it's much easier than it was before because everyone has a patient portal that they can access their lab results in. Always request your blood work. A lot of physicians are busy. I hate to say it, but things often do get overlooked. We had a very scary case actually where a patient was going to the hospital. We were treating her for back pain, but she knew we looked at blood work for cancer therapy, and she'd been in remission, and she was recently told that she was no longer in remission. The hospital that day actually mixed up test tubes, and her blood work was from that of someone else. So it had her name on the script in the paper, but we were looking at it, she's like, Dr. Frank, I've never had high cholesterol. I've never had these problems in my life with or without cancer. I don't think this is my blood work. And sure enough, at the end of it, it wasn't her blood work. It had her name on it. So I always tell patients, request your blood work. Now, when you receive the blood work, and Stacey, I think it will be easiest if I attach the copies at the end. I don't think people would get a good visual, but there's usual ranges on the sides, okay? And they tell you within normal limits or not within normal limits. So for example, I'll look at glucose here. Let's see what they recommend. So my reading was a 90. The accepted range is 65 to 99 before they consider it being prediabetes or elevated. It's very easy to reference that. The only thing I would advise is, yes, speak to your physician about those numbers, because if you notice you're a little bit on the high side of something like your HbA1c, for example, within normal limits is usually a 5.6 or below. If you have a 5.7, a lot of physicians might just say, oh, you're fine, blood work looked great. When in reality, that's basically prediabetes. And remember, I think last week we said I think the statistic was about 40% of people don't know they have prediabetes. And the majority of those individuals have had blood work done before. No one ever told them because it wasn't coming up as a blatant red flag. Everyone's different though. My blood sugar levels back before I made some changes, having 90s, even into the hundreds was pretty standard for me. You may have another individual where that's considered high for them and they may be in the 80s. And that's where you and your physician can work together. Ideally, they've done blood works on you in the past, and they can say, listen, this is a normal reading for you. You've presented with this before, no need to worry. As compared to, hey, there are some dramatic changes happening here. So yes, there are references. I always tell my patients, ask for your blood work, look at it yourself, and then if you have questions, ask your physician what's going on. Sometimes things don't add up. It's always good to double check.
I think that's great advice. And, more and more, it's being recommended that we take charge of our own health care, right? Our own care, and that you're an active participant and not just receiving the information. If that patient that you were just talking about was not aware that she had not had high cholesterol in the past and some of the things did not look off, who knows what path she could have gone down treating something that didn't exist, right? So I think that's really, really important to note. And that's why we're recommending that people get a baseline test so they understand where they are. So when they take another test a year later, or depending on what the results are, 3 months or 6 months later, they understand what their blood work is telling a physician and telling them.
And I love having the blood work too, especially for the patient, because let's say we're working with someone who is trying to improve their cardiac health, their diabetes, or some of these lifestyle modification-based diseases. This is a great way to track your goals. So when we're working with a patient, I give them a copy of their blood work and I say, okay, your blood sugar levels right now this morning, we're at 125 and we want them to be in the 90s. And your LDL was into the 200s and your C-reactive protein, a marker for inflammation, was very elevated. I say, we're going to do this again in 3 months, 6 months. We're going to order these lab results again. And I want to see a difference. And now it becomes a tangible goal for the person, whether that's a client, a patient, whoever that may be, as compared to something that you're not really involved in. So that active role really is important. Absolutely.
So let's talk about where your blood work, what story your blood work told you and how you made modifications.
Of course. Yeah, that's great. And as I go through that, I'll mention along the way some additional testing that I was able to request just due to my functional medicine background and my knowledge of it, that I feel most patients should be talking to their physicians about. I'll mention those values as we go. So the story really starts back in 2015. I had been out of college at that point for about 1.5 years. And I explain to people when I tell the story, right? College was 7.5 years of schooling, long nights of studying, lots of caffeine consumption. I really wasn't healthy in college, and this may surprise people. Most people in any form of medicine, they're really not. They're studying a lot. The hours are crazy. If you're working a full-time or part-time job during it, you really don't have time for that self-care. So I think it's safe to say during those years, things were slipping. So it was in 2015, I really didn't feel well, and I said, okay, it's time to really go get some things looked at. And mind you, this was in the beginning of my career, so it was really a scary time to feel sick. You're excited and the wind gets knocked out of you. So I went to the doctor and they ordered a lot of blood work as per my request, and they were concerned too, so they ordered some. And some of the things that I'll mention that were elevated, that were alarming, were in my metabolic panel. I had elevated calcium levels. That could indicate problems in the parathyroid gland, a gland near your thyroid. That could be indicative of different types of cancers. There's a lot of bad things. It could just be hypercalcemia because it's a genetic trait that I have. I had elevated protein levels in my urine and in my blood. Again, indicative of all types of diseases, inflammatory diseases. I had elevated cholesterol. It was again, we'll post these, but it was a 249. My HDL was a 57. LDL was a 192. Way out of the normal ranges on these numbers. As I continue to flip through it, it's amazing looking at it. My HbA1c, now I'll tell you, at this point in my life too, I was probably at my leanest point as well. I felt that I was in the best shape I had been in. My HbA1c, my blood sugar levels were a 5.8, which is prediabetes. That would be considered prediabetes. In my urine, I was excreting ketones. It appeared to have a cloudy appearance, maybe some type of bacterial issue there. They did a serum protein electrophoresis, again, to further dive into the idea of autoimmune disease, ruling out cancers. And unfortunately, I had some protein levels in that were elevated and low. I had very mixed results on that. And then the last marker that I had requested was homocysteine, which is an amino acid that's released specifically related to the arteries. That was also elevated too. And as I mentioned in previous podcasts, having a family history of cardiac disease and heart attacks, that was very alarming for me. So that was my first wake-up call. I went through all sorts of doctor's visits, and I would tell them, listen, I have a history when I was back in early college of nicotine usage. I said I was drinking these energy drinks, right? Sugar-free energy drinks to stay up and study. My hours of sleep weren't good. And I would keep saying, I think this screwed me up. And the answer was always, no, that's not it. That there's no way, you're way too young to have these problems and have it be from a lifestyle factor. So I continued to go. I saw specialists. I saw ear, nose, and throat doctors to look at my parathyroid. I went to neurologists. I had seen rheumatologists. I had low bone density as well, too, at the time. So I had seen a host of physicians, and we really weren't getting anywhere. At that point, I had hit the brakes, and I said, okay, I just have to focus on my business, unfortunately. I have to keep going. I couldn't balance the two. So it was in 2017. Again, I still wasn't feeling great. I had made healthier choices, but we did another blood work. And without going into the details, I'll post it, but it looked very, very similar. The calcium levels had dropped. We'll talk about how a little bit later, but the glucose levels were still elevated. The HbA1c was elevated. The cholesterol had gone up over time. It really wasn't making any sense. I'm looking here too. My thyroid hormone levels were off. Testosterone for a male my age was actually low for a male in his 40s. So there was obviously something happening. Again, another round of doctor's visits, and I had all types of recommendations. We're going to give you the one that really turned me off was the testosterone patch. They wanted to give me testosterone. Now, mind you, I was only in my 20s at that time. I really didn't feel that was right, and it didn't answer the question of, okay, why is this happening on my lab work? It wasn't until around probably mid-2017, 2018, that I went to a neurology clinic here in Western New York, one of the larger ones, and I met with the head of the clinic there. And he took a look at me and he said, listen, I'm looking at all your stuff. And he said right away, he was like, I don't think you're actually as sick as this points you out to be. He said, I think your lifestyle factors in the past played a big role. He said, I want you to quit the caffeine. At the time, I hadn't used nicotine. He was like, I want to make sure that there's no nicotine in your blood. And I really want you to normalize your sleep patterns. I want you to, he actually requested that I had stopped working one of my part-time jobs in that year. And I did. I listened. He was like, you're going to have to rest. And if you don't get better in about 30 days, he was like, we're really going to have to start doing some more advanced testing on you. And it was an amazing thing. Over time, during that 30-day period, I started to feel better and better and better. And it was to a point where I could tell I was feeling better. And that's really where I ran into CBD oil because, and I tell people this, and it's not a topic worth discussing today, but one of the hardest things he said for me was going to be coming off of caffeine, believe it or not. He was like, I think you have a caffeine allergy, and I think you're going to go through really a rough time giving up caffeine. And he was right. I really struggled with that. And the CBD, one of the things I was reading about online was how they were using it for people with other withdrawal from nicotine, alcohol, things like that. Fortunately, I didn't have those issues, but caffeine was a big deal to me. I was like, wow, like I don't like having a headache every morning starting out. And that was really where I started to use the CBD in the whole healing process. And it certainly made those 30 days of giving up caffeine, some of those lifestyle factors, and I started to sleep so much better. That was really where I started to get involved with the CBD and the lifestyle changes, and really started to take myself seriously as a patient as well too. I think sometimes it's easy to give advice to others, but to not always follow it to a T like you would want. It was then in 2019, this was actually probably just from a few weeks ago. Yeah, 3/20 of 2019. We ordered another comprehensive blood panel, and almost all those values between 2015 and 2017 had dramatically changed. Now, I have had high cholesterol since the age of 18, and they wanted to put me on statins and beta blockers to manage the cholesterol and the blood pressure. Personally, it's something that I wasn't looking to start at such a young age, so we opted not to. And I'll tell you, for the first time in years, my cholesterol normalized 186, HDL remained high. My triglycerides, even though I had actually gained weight during that time, decreased from what they were once at a 67, which is pretty low. They dropped down to the 40s. So I really saw my lipid panel respond amazingly. Testosterone levels normalized again. In my offices, we have access to a DEXA machine, which is how you test your bone density. I had scanned myself on the DEXA machine. Bone density increased. I mean, it was really dramatic. Glucose levels, non-fasting. And this blood work I got in 2019, I forgot I had the appointment. So I'd eaten my breakfast before I had gone. So these numbers are non-fasted, which is just mind-blowing. My glucose was a 104 non-fasting. Usually it should be much higher than that if you had eaten. I mean, really lots of things, and I'll put those results on there, changed. Homocysteine levels for the heart, those went down. Now, one thing I'll say is this. CBD oil currently in the literature, there's not a lot of literature out there saying it's going to decrease your blood work when it comes to C-reactive protein. It's going to decrease your cholesterol. There's not clinical trials that exist supporting that yet. There's a lot of hypotheses, there's a lot of science stating how it should impact those things positively, but I certainly wouldn't want to tell someone, hey, because I took CBD oil and that's all I did, this is what happened, right? We got rid of a lot of bad habits. Nutrition changed dramatically. Got more towards an anti-inflammatory diet, low glycemic diet. That was a big help. Again, as I said, I had to take time off from some of the jobs that I was doing to rest. So there was really a lifestyle approach to that. But I can tell you today, it worked. In 2019, it was an amazing thing. And I don't think I would have been in the position, this is where I feel bad for people, if I didn't have the knowledge base that I had. Because the road that I was being sent down, and thank God I met that neurologist at Dent, would have been a very, very complicated one. And I'm very fortunate that I knew the testing to ask for and we knew what to do. So some basics on testing that people should ask for. C-reactive protein, I think that's a great one. Most males, I think, should be requesting total testosterone and free testosterone. Any of our thyroid patients out there, typically when you get your thyroid tested, they're only testing TSH and T4. We always request TSH, T4, antibodies for the thyroid, T3, free and total T3 as well. Gives you a much more comprehensive view of the thyroid. And even serum iodine levels too, if those values are off. That plays a big role in thyroid health. HbA1c, homocysteine in your cardiac patients, I think that's a good marker to check. Certainly the C-reactive protein, which I mentioned, and then people who are suspicious of autoimmune disease, which they had tested on me several times, but it kept coming up negative, something called an ANA. It screens you for a host of a bunch of different autoimmune diseases. Usually that involve the joints, but you can pick up some other things on there too. And I just say that special testing was so important because it gave a complete picture. If we didn't have all those values to step back and say, hey, there's almost too much going on here for this to be one isolated incident, it really was the definition of lifestyle modification. And like I said, I believe firmly that CBD played a role. Now, whether my cholesterol and my cardiac markers got better because I was sleeping better or because CBD had a direct impact, research will have to tell us one day. But I certainly noticed a change. And between 2017 and 2019, there was a much bigger change between 15 and 17. And really the main difference was that introduction of the CBD, and giving up caffeine was a big one for me too. But yeah.
Well, I think that's great advice, the different tests that you mentioned. And I don't want to go down this road too much, but one of the things I hear from people is, well, that sounds really expensive. I don't know if my insurance will cover it. Do you know if insurance covers most of those tests for your patients?
So that's a great question. So yes, a lot of the tests that I mentioned are covered with insurance. The problem that people run into today are their deductibles. They have $4,000, $7,000 deductibles, in which case very few to none of the blood work is covered. So in that sense, you do run into problems. With that being said, in Buffalo, New York, there's a bunch of different lab service companies. In most states there are. If you talk to the lab service providers, there's usually a cash price available, and it's usually much, much, much less expensive. So that's one thing that you can consider, offering a cash price, and the lab is usually willing to come down. A lot of labs also offer payment plans for patients as well too, so that's an option. There are interest-free credit cards available for patients that have 0% interest for a year, meant for medical procedures like lab work today. Sometimes if we really feel we need blood work, we'll encourage a patient to put it on maybe one of those 0 interest-free cards. And of course, we in no way benefit from that. Another thing too, and this is new and goes to your point, there is now a plethora of online testing available. There's also a plethora of special testing available for people. So cortisol was always a big sticking point with people. They would want to test their cortisol levels. Physicians want nothing to do with it. Whether it's an endocrinologist, a specialist, a primary, they don't want to test it unless you have some really blatant disease process. You can test that through at-home kits now. Labrix makes an at-home kit. There's Immu Foods for allergy testing for foods. They're now doing genetic testing. The reliability of those gets a little dicey with the saliva and the genetics, but it's an option for patients. So you can seek out these tests on your own now. I'll attach some links to some reputable labs that people can go to and access this. Most physicians are willing to do it. Most labs are willing to work with you. And I do.
Dr. Frank, you mentioned cortisol. The reason that's important is because it's an inflammation marker. So that's obviously, if you're inflamed, that's an inflammation, we know from your previous talk, is the root cause of most diseases. So understanding cortisol is very important. I know that it is something that physicians don't want to always recommend, because the other thing is, a lot of times cortisol is a more expensive test and it's a separate test. So, but let's not, and the reason we're talking, this is something we don't normally talk about, but the reason we're stressing this is because it's really easy for people to say, you know, I don't have insurance, or that's expensive, or my insurance doesn't cover it. But the reason supplements that can help, or the reason as understanding your blood work is so important, is because we're trying to be preventive. We're trying to say, hey, let's understand where you are and what you can do through diet and supplements such as CBD now to prevent disease, because we don't want to be reactionary, right? We want to be doing things and understanding where your body is today so that you can supplement with something like CBD to help. So that's what Dr. Frank's really talking about, of all of these recommendations. You know, he was able at one point to say, I don't feel good, let's figure out why. but he was also, of course, he's a doctor, right? So he has a head, you're in a better position than the rest of us, but
Sure.
that's why we really want this information to be helpful to you. It's so important to be pushing for this information because your blood work tells you so much. So making it a priority, hopefully your insurance covers it or some of it, but making it a priority, we're really trying to stress that so that you can benefit from things like CBD.
And to your point too, especially with the cortisol and asking for that testing, that's an easy one to do with saliva online. Saliva is usually even preferable and it's usually not covered. But my point to that is we've seen patients, we tell people, your health is your wealth at the end of the day, right? If you're so sick that you're having trouble getting out of the bed in the morning, and of course there's diseases where we can't control that, where it's just maintaining and giving that person a quality of life. But if it's something that's presentable, and we see that in phase 3 adrenal fatigue syndromes, if you can get that sorted out and now you can get back to work, get back to being productive, you will financially benefit from that one way or another.
Totally.
To your point, people miss it. The less you invest into your health, it's going to be more expensive later on. One point or another, it's going to catch up to you.
Yep.
At one point
And
or
my
another.
doctor, one thing my doctor did, she's functional medicine, and she actually was very proactive and created a contract with a lab. So there's a lot of options out there. So discover your options and shop around, and we really want you to do this for your health and your eventual wealth, right?
Yeah,
Eventual wealth.
exactly. Exactly.
Okay,
True.
so we've talked about some of the tests that are important. We've talked about making it a priority and finding a way, even if insurance doesn't cover it. Let's talk about some of the benefits that we do know about CBD. We have a government patent that says that it's a neuroprotector, it's an anti-inflammatory, it's an antioxidant. It can help create balance or homeostasis in our system. So let's talk about that for a minute, because that word homeostasis, right? That's a word that we don't use very often, but creating balance. So the way I interpret that from some of the people that our customers that we hear from, just literally hundreds of people that we've heard from, they always say, well, this number was out of whack, and I started taking CBD and my next blood test actually showed that it was in balance. And that people who have diabetes are talking about their sugar levels, right? So you might take it for pain, or you might take CBD for inflammation or for sleep, and lo and behold, you might find balance in another area. So can you speak to that a little bit?
Absolutely. Yeah, that's probably the most common thing you hear about that CBD, right? It brings homeostasis, it brings balance. And I'll go back, I think we mentioned this in one of our earlier podcasts that we did. Your body has an endocannabinoid system in it, and your body makes its own cannabinoids. That endocannabinoid system and the cannabinoids present in your body regulate almost every organ. They're tied to your reproductive organs, which are responsible for your hormones. They're present in your brain and your spinal cord, which regulate your nervous system. They're present in your gut, which regulates your gastrointestinal health. Your immune system, which about 80% of it exists within your gut, also is responsible for containing tons of receptors for CBD oil. So when we talk about balance and we talk about how CBD works, I think one of the big things to remember is that people who seem to have issues with endocannabinoid tone or flaws in their endocannabinoid system, they have low levels of cannabinoids and they have high levels of an enzyme called FAAH. This enzyme chews up your body's own cannabinoids, okay? When you take CBD oil, it blocks that enzyme, allowing your body to start to make more of its own cannabinoids. So now, based on a lot of the literature out there, it's starting to say when your endocannabinoid system is balanced, it's going to go regulate all of those other systems present in your body. So maybe it wasn't, and we'll find out more as research comes out, the CBD oil that necessarily raised the cholesterol, but maybe it was those anti-inflammatory effects of balancing your own body's cannabinoid system that helped clear some of those triglycerides, right? That helped lower some of that blood pressure. So I think that's one way. And one of the big things, and I encourage people to, I'm sure we'll do one in the future, to learn a lot about sleep. Sleep is so important. And recently I was in a functional medicine seminar and they were saying, what was the missing link? We never really talked about sleep too much, whether it's in a primary care setting or in a naturopathic setting. Sleep isn't always discussed until recently. Now it's a hot topic. Sleep is when your body releases human growth hormone and testosterone and all these great things. So if someone isn't sleeping properly, of course their cholesterol is going to get screwed up. Of course their blood sugars are going to be out of whack. Of course we're going to see more of those inflammatory markers. So for me, I ask myself that. I can't help but to wonder, did CBD individually affect each of these systems? Or did the CBD just rebalance my own cannabinoid levels to now where everything's at that homeostasis? And I bring up that enzyme because I find that so fascinating. I believe, and I'll confirm this, so don't take this 100%, but it was a trial with people who were chronic pain and alcoholics, where they were studying those blood levels of FAAH, and they were studying the levels of the endocannabinoids, the one your body makes, and they realized that enzyme was very high, the cannabinoids were low. And when they administered CBD, it seemed to block that FAAH enzyme. Now, the fascinating thing is, and this is really what's amazing, is these same scientists said, okay, so what if we just turn off that enzyme for people? Can we cure pain? Can we cure PTSD? Well, the answer was no. It actually went really bad when they did that in mice, when they turned off that enzyme in mice. But the fascinating thing is CBD, from what they're seeing, doesn't seem to completely turn off that enzyme. It regulates it, which is a great thing, because when we take certain medications, they completely turn off certain aspects of our body. They completely shut down, whether it's, I don't want to speak wrong, cholesterol production would be a good one. You're always better off trying to seek balance than turning off one of these body systems. So for those reasons, I think CBD is a good bet for the time being. Absolutely.
I think that's a fantastic description, and it really helps explain. And there's so much about CBD that we still have to learn. It's exciting that we're learning more and more, and so much of what we go on is based on what people are telling us, right? And the experiences that we receive and hear about on a daily basis, the experiences that you are having in your office, and physicians across the country that are using our products, such valuable feedback that we're getting. But what we do know is that CBD is safe, right? So it's a safe experiment.
Yeah, and that's from that government patent itself. They said in there does not appear to be overdose potential at the time. They said in there doesn't also appear to be dependency on CBD. So the answer is yes. And to your point, and this is why I really respect you guys as a brand, things are becoming unsafe in the world of supplements. They always have been, but now more so than ever, whether you're talking about CBD or whether you're talking about counterfeit medical vape pens, whatever it may be, you are seeing products made with high amounts of THC and they're not telling people. You're seeing products made with pesticides that are showing up when there's consumer reports being done. So CBD, when you have a good quality product, is so far determined as safe. I'll send you the list of medications that it does interact with. I tell people that might be where you might run into some safety issues, especially if someone's on, I say, chemotherapy drugs, warfarin, those heavy blood thinners. You could run into some trouble. For a healthy individual, though, for someone who doesn't have super complex medication history, yes, it's regarded as safe. And that's not, I like to emphasize, that's not me saying that. That's the literature saying that. That's that government patent saying, yes, this appears to be safe and extremely beneficial. So absolutely. But watch out for the counterfeit products, because I'm seeing more and more stuff out there now, and that's alarming. I actually think they had a really bad case of it was an illegitimate brand, unknown company, who knows, it was probably someone in their basement, and they had some pretty harsh toxins in their products. It was actually in New York State that it occurred. It was synthetic marijuana that they were distributing as a CBD product. So it was unfortunate, but
it's scary. And that's why, as a company, because this is not an FDA approved, this is not a regulated product. So that's why, as a company, we take the extra step so that everybody knows we test third-party tests from plant to end product. So it's tested multiple times. We have certificates of analysis on our website. We have a QR code on the bottle that takes you right to the testing. So we want you to feel confident that when you buy from us, you're getting a quality product. And to Dr. Frank's point, whether you buy from us or you buy from somewhere else, make sure that you know where it's coming from, so that you trust the product, because there are good companies out there, but there's also a lot of companies out there that are popping up and are not taking the steps. They're maybe not even intentionally offering you a bad product, but it's not tested. So on that note, we appreciate your time, Dr. Frank, and your wealth of information. Thank you for making it so easy to understand.
Of course.
And I appreciate it. I hope you as a viewer were able to get some valuable information here today. We will include some information on our website in the blog section, so that you can use that as a reference as well. So thank you for your time, and I hope everybody has a great day.
Of course. Thank you, Stacey.